Hi, I'm Natalia. Today I'm gonna demonstrate the pre-operative phase of a patient. Just to let you know what sort of data you have to collect for a pre-operative patient. So, um, the aims of this phase are the person is prepared, so physically and emotionally. So, preliminary studies such as EKG and blood work done and informed consent obtained, and the post-operative phase is the prevention of complications. So let's talk about what you have to do for a pre-operative patient. So first thing, as the nursing assistant, you have to fill out this form. So this form just collect all the data that you need for and that is needed for the surgery. So the first one is the patient's name, obviously, and the next one the date and the height. You have to measure the patient's height. Some in the hospitals you have the scale where you ask the patient to stand and mark the height, and then you write it down. And then the weight, you have scales in the hospital, so you ask the patient to stand on it and you record the weight. And then the identification band, there's certain sort of band, some sort of band uh, uh, for patients to identify that he's um, going to be admitted for a surgery. And you have um, you have also signed a consent asking that the patient is fully known that he's gonna do a surgery, and he agree with this surgery procedure. So you have to get that informed consent sign, and you have to get the sign and special permit signs, example sterilization, uh, special permit sign. And surgical state, you have to know whether it's sterilized or not. And the next one, history of physical examination report. You have to understand whether there are history or physical examination reports. Maybe it's physically present, or sometimes it may be digital. So according to the convenience of the hospital, you can get it in the physical way or even in the digital way, it doesn't matter. And the date. So laboratory records, you have to ask the patient whether you have the laboratory reports and records, or if the patient has been admitted for a long period of time in the hospital, you should be having the laboratory records. So you have to, the laboratory records are basically these things you have to know. CBC is the complete blood count, and HGB is the hemoglobin in the blood, and urinalysis. And the next one you can see, it's um HCT. So meaning of HCT is hematocrit test. So it's a simple blood test that measures the percentage of red blood cells in your blood. And the next one you have to know is these points, the natural teeth. So are all the teeth of the patient are natural. So dentures, upper lower partial, so bridge, fixed crown. So you have to tick if it's present or removed or whatever. So natural, you have to consider this one, because if the patient mostly if the dentures, so dentures may remove. If it is an artificial one, during the surgical procedure it may remove and get stuck in the throat of the patient, that may cause serious situation over there. And the next one is contact lenses, that the same theory applies with the contact lenses too. That means you have to check whether the patient is having any sort of contact lenses. The next one, you have to know about other prostheses. And the next, you have to know about the jewelries, the jewelries, the wedding band or the rings, earrings, neck chains, or any other body piercing you have removed from the patient. And you have to the patient can either give them to the nursing assistant, or else it is very safe if the patient is giving it to a relative. Or the thing is, there are many people around in the hospital, so when the patient has left the jewelries over there, so they can be robbed. So there may be patients or bystanders um, over there and very good at theft. Or else there may be some visitors come in there just like thieves and take in these things. So you have to be very careful. And even if you're taking the things from the patients, that it's I guess it's the best option is to give the patients jewelry items to a relative, because otherwise you'll be accused of theft. So the next one, you have to remove the makeup and nail polish. So nail polish you have to remove, because in order to know very well about the uh, blood flow. So just to know very well about the blood flow, you can just for nails which you haven't applied nail polish, you can see very well when you pinch the nail at the bottom, uh, the color changes, and instantly when you remove the pressure, the color changes again. So this thing cannot be identified if you have nail polish in the nails. So same thing, the makeup. So makeup will also cause some sort of it's again contamination. So the next one, the clothing. So the clothing is, the patient should be having a patient gown, wearing a patient gown, so that it is very easy for the doctors to remove the patient gown and do the surgery. And then the cap, the patient should be having a cap and a sanitary pad. The sanitary pad is the sheet which the patient is lying on. And the next one, uh, it's a family instructed where to wait. So this should be sorted out with the family members. So if the patient's wife or husband may be there, so you can ask the patient is instructed where to wait. Or sometimes there may be some sort of surgeries which take 6 hours, 7 hours. And some sort of, also there may be some sort of surgeries which may be like uh, 10 minutes. So however, whatever the surgery is, you should inform the patients, bystanders, or the visitors, the family, to wait where to wait. So ask whether they're gonna stay for this long, or they're gonna go and come back when the patient is conscious. And the next one, are the valuables secured. And the next one, you have to know the blood availability. So what you have to do is take a blood sample and make the test, so uh, you can understand what sort of a blood type is the patient having. Sometimes after a big surgery, a large surgery, the patient may need any sort of blood transfusions. So much of bleeding may happen in the patient, so needing the urgency of a transfusion. So at that moment you have to understand what sort of blood is in the patient's body. Is it A positive, O positive, or whatever? So you have to give him with the compatible type of blood. So the you have to know where the blood is available. Is it available, if even though if you know the type of the blood, if it is not available at fingertips, you couldn't give it to the patient. And next one, pre-anesthetic medication. you have to understand whether there's pre-anesthetic medication given. So pre-anesthetic medication is that sometimes the patient may be sore, confused with the type of surgery he's facing. So in order to calm the patient, you have to give this pre-anesthesis. So sometimes a, sometimes some sort of surgeries may cause lifelong suffering. Sometimes if the patient is asked to remove the uterus, um, and if the patient was looking forward to have babies, but she now have to ultimately remove the uterus and she has no option other than that, the patient may not be calm, and you have to calm. So in order to, you have to have a calm environment to do the patient have, sorry, the doctor have to have the calm environment do the surgery. But so for this purpose you have to use pre-anesthetic medication. So you have to then report the type and the time you gave it. So voided, what is voided? Voided is actually the urination. So voided or not, so this one you have to report in order to um, in order to get the information that you have to implant a catheter or not. It can be a Foley catheter, it can be a French catheter, whatever. And if the patient is, you have to ask voided. So if the have urinated, do you have the urgency of urinating right now? So if the patient says no, you have to put a catheter, because during the procedure you have no the patient you have the patient has no care facility of urinating, so you have to put on a catheter. So you have to understand, also you have to understand whether mouth care is given. And the next one, you have to check the vital signs, the temperature, the pulse, the respiration, the blood pressure. These things should be recorded. And next one, you have to understand special problems such as allergies. Does the patient having any sort of allergies or deafness? And the next one, he should be understand you should understand any sort of area of skin preparation. And the next one, you have to get the signature of the releasing patient, nurse releasing patient, signature of the nurse releasing the patient, and then the date and the time of release. So these are the information that you have to know, that you have to gather for a pre-operative care. So in order to do a surgery, you have to have a very good education. That means 6 years of education. But pre-operative care, you can a nursing assistant could do. So these are the things that you could do. So I hope you got something from the video. So until I'll get something again from the next video, until then, stay safe. Thank you very much for your attention.